Okay guys, in this video we will be discussing vasculitis. Vasculitis means the inflammation of vessels, right? So now the important points related to the vasculitis is that in the vasculitis there is a deposition of the fibrin that leads to the stiffness of the walls of the vessels, right? And secondly, it can also lead to the weakening of the walls, which can lead to the multiple aneurysms. Now, talking of the symptoms of the vasculitis, the symptoms can be general or they can be specific. The general symptoms can be because of the inflammatory response. So, these general symptoms are like fever, weight loss, and fatigue. But the specific symptoms, they are basically they depend upon the organ which is supplied by the affected vessels. For example, in case of the heart, we may see the symptoms like the myocardial infarction or the ischemic heart disease. But in case of the brain, we can see that it may lead to the stroke, right, in the lungs, or you can say the kidneys. So in both of the cases it can lead to the hypertension, right, in both of the organs, and it can also lead to the edema there. So these are some examples of the specific symptoms, right? Now basically vasculitis has many types. It depends upon the size of the arteries, right? So in this video we will be discussing the types of the vasculitis, which are based on the size of the arteries, which is a large size. Okay, so the large vessels. So the first type is the giant cell arteritis, which is also known as a temporal arteritis. Later on I will tell you why it is known as a temporal arteritis. Okay, then we have another type which is a Takayasu's arthritis, which is a pulseless arthritis. Okay, now in the cell arthritis, we see that it basically affects the people who are more than 50 years old, and it is more common in the women as compared to men, and it affects the carotid artery and their branches, right? So in the temporal artery, basically it is mostly affected by the vasculitis. So this is the most important branch that is affected by the giant cell arthritis. Okay, so the temporal, now we're gonna see the symptoms that are basically gonna be produced by these branches when they're affected by the giant cell arthritis. So in the if the temporal branch is affected, it can produce the headache, right? It can lead to headache. And if the ophthalmic artery is affected, then it may lead to some visual problems, right? If the facial artery is affected, it may lead to the pain while chewing, which is known as a claudication, right? Then in the lab test, you may see the raised ESR, which are the erythrocyte sedimentation rate, and the giant cells in the IEL, which is basically the internal elastic lamina. So internal elastic lamina, it's the thin sheet of the, you can say, the connective tissue that is present between the tunica intima and the tunica media. So basically what is present in the giant cell arthritis is the granuloma. Okay, the giant cells are basically the granulomas, right? So the granulomas are present there, and this is segmental. It means that it would produce you can say the disease in the segments form, right, in the form of segments. So like if this is an artery. Okay, so for example, if this is an artery, so it may be affected in in different segments. So you have to take a longer segment in case of, if you are doing any biopsy, so that you may not select the unaffected part. So you may misdiagnose a disease, right? So that's why you need a longer segment, because this is segmental, right? And the treatment for the giant cell arthritis is that you need corticosteroids, right? And the complication is that it may cause blindness because it is affecting the ophthalmic artery, right? And as I've told you that the granuloma is present here in this condition, and the pathology of the giant cell arthritis is that it is T cell mediated, and there are some you can say the chemokines, or some you can say the inflammatory mediators which are released, that these are basically the TNF and the anti-endothelial cell antibodies, right? Now the second type is Takayasu's arthritis, which is also known as pulseless arthritis, right? And this condition basically affects the people who are below 40 years, and it is most common among the Asian women. And it basically affects the aortic arch and its branches. So it would produce the symptoms in the upper extremity and in the head as well. So in the upper extremity, it would lead to weak or no pulses, right? While in case of head, so it may cause the visual disturbances or the neurological symptoms. Yes, and now we're gonna see the similarities between the two conditions. So the lab in the lab test, you may see the raised ESR in both of the conditions. The giant cells are present in the internal elastic lamina in both of the conditions. It means the granulomas are present in both the conditions, right? And the treatment is same. We give corticosteroids to the patients, right? And the complication in the giant cell arthritis was blindness, and same is the case here. That in the Takayasu's arthritis, basically it has marked ocular symptoms, right? So we can say that the complications are resembling as well. And the pathology of Takayasu's arthritis is autoimmune mediated, right? So this was all about the large vessels vasculitis. So in the next videos we will be discussing the vasculitis of the other vessels, of the medium and the small size vessels. So if you have any question, you may ask in the comment box. Thank you.